Hello, and thank you for joining me for this presentation on an alternate treatment for postpartum depression, progesterone. What is postpartum depression? So, postpartum depression is defined as the onset of a major depression associated with childbirth that negatively affects the mood and behavior of the parent. Both women and men can be affected by postpartum depression, but for this presentation, we'll just focus on the women. These are some common symptoms I listed: frequent crying, irritability and fatigue, feelings of guilt, intense anxiety, especially surrounding the care and the health of your baby. Sometimes women can get very controlling and obsessive about who's watching their baby. They might want to do everything themselves. They might have trouble sleeping and loss of interest in activities they used to find pleasurable. Some risk factors for people who might experience postpartum depression: hormone changes after pregnancy are very significant. Lack of support, life circumstances, genetic predisposition, history of depression. Having a baby is a major life change for a woman, and sometimes it affects people differently. These are some common treatments right now. We have talk therapy, antidepressants, and mostly a mix of both. This is just a little graph of states that have statistics on postpartum depression. It looks like Pennsylvania is definitely up there with the highest. I'm curious where the warmer states are on those lists. These are common antidepressants that are prescribed if you don't have a history with antidepressants: Zoloft, Prozac, Paxil, Celexa. They all typically take the same amount of time, but it's a case-by-case basis on the patient. 4 weeks to months to begin to show improvements from postpartum depression. And if they don't, they might have to adjust the dosage or the type of medication. They can be really effective for women, which is great. They do have side effects: nausea, headache, dizziness, sedation, insomnia, sexual dysfunction, nervousness. There is a chance that some of these can get into the milk if you're breastfeeding, and especially if you're using hormonal contraceptives with this, you might have even more significant side effects. So, what's the alternative? Well, first of all, we should talk about what progesterone actually is. It's a hormone that supports a woman in her cycle and her ability to maintain and support a pregnancy. Progesterone helps prepare that lining of the uterus for potentially fertilized egg to implant and grow. Around week 10, after a woman conceives, the placenta will take over and produce the progesterone for that pregnancy and for the woman. It's also known to be a calming neurosteroid that helps improve mood, supports thyroid function, and helps prepare the body for lactation. So here we have a graph of the role of progesterone in the typical cycle. The navy blue line is progesterone. It's low throughout the cycle. Then once we hit after ovulation, it gets a little bit higher there at the end. So if conception occurs, it'll stay high. If not, it's going to dip down. So low levels of progesterone can actually cause irregular menstrual periods, difficulty conceiving, mood changes, anxiety or depression, trouble sleeping, hot flashes. If you're pregnant, low progesterone could lead to miscarriage, ectopic pregnancy, or preterm labor. Some women are prescribed progesterone throughout their entire pregnancy just to maintain a healthy baby. But what if your levels of progesterone are high? Well, you could have breast tenderness, water retention, fatigue, anxiety or agitation, depression, reduced sex drive, or weight gain. This is some of the conflicting information that goes into deciding whether progesterone would actually be a good treatment for postpartum depression. Here's a graph of what happens after pregnancy. If you look at the green line on the graph, levels plummet after the delivery, which is maybe to blame for some people's postpartum depression. Leads us to this next graph of a small study with women who experienced postpartum depression and were treated with the use of progesterone. This study showed that the symptoms lifted very rapidly with a 95% rate of effectiveness after using the bioidentical injections of progesterone. These are the treatments that we have today for progesterone treatments for postpartum depression. The FDA approved in 2019 brexanolone. It's a 60-hour inpatient infusion with symptoms improving within 1 hour to peaking at 24 hours of this infusion. You do have to be monitored over the 2.5 days, and this is actually difficult to access. It might be very expensive, but you're monitored for loss of consciousness. You can't breastfeed during this, but it might show huge improvements to somebody's postpartum depression, so it may be worth it. In 2023, the FDA approved zuranolone. It's an oral tablet taken for 14 days, and symptoms can improve within hours to days. There are some short-term effects listed here, but no long-term side effects. And last, we have the use from 1980s, although not FDA approved for postpartum depression. We have bioidentical progesterone injections, and these can be taken intramuscularly. They are shots given every other day over the course of 10 days if needed. They do have some short-term side effects, but this is huge. This could be really wonderful for someone who needs to get this postpartum depression taken care of, and they're interested in trying this out for no long-term side effects. Why isn't progesterone a common treatment for postpartum depression? Well, as you can see from the presentation, there are a lack of studies. There are conflicting information. Sometimes if you have progesterone that's too high, there are some negative side effects. My personal thoughts is funding is probably an issue. People are probably used to, in our society, turning to antidepressants and not trying something new, unfortunately. So it'd be great if this could be further researched and studied for women. Just in case you were curious who could provide this treatment here in Pittsburgh, we have a Dr. Blaise Milburn, who's a naprotechnology surgeon. Natural Procreative Technology is what NAPRO stands for. And these are a group of doctors who focus on finding the root cause of infertility issues and cycle issues instead of prescribing a hormonal contraception to mask symptoms. So they try to get to the root cause of things. And he is someone who does provide progesterone shots for postpartum depression in our area. Here I just have some of the methods listed that are popular for natural birth control. I have personally used a symptothermal method. It's a mixture of taking temperatures, looking at your mucus, and that way you can figure out when your fertile period is and expect when you should, go through your next menstrual cycle, etc. The benefits of all these natural birth controls are there's no side effects. You have improved communication with your partner. Study shows low divorce rates for married couples and a more satisfying intimate relationship. In conclusion, I hope you'll find my evidence strong for the use of progesterone for postpartum depression treatments. I like to note the natural birth controls just because they go so well with the bioidentical injections of progesterone and the idea that your body can be balanced naturally without using a bunch of compilations that create the antidepressants that women are normally put on for postpartum depression. Thank you so much for listening to this presentation, and if it's appropriate, if you know anybody who is struggling with this in their life, please share, and maybe this will be a good solution for them. Thank you.